Greetings and welcome to this press briefing that we hold weekly here at PAHO on COVID-19 pandemic here in the region of the Americas. My name is Sebastián Oliel with the Communications Department here at PAHO. And as every single week, we will be accepting your questions live during this press briefing. We have already received your questions via email, and you will also be able to send your questions live and also through the Q&A button. Please do include your name and communication outlet when sending your questions. And let me tell you that we do have simultaneous interpretation into English, Portuguese, and French, and you can choose the language of your preference by clicking on the interpretation button. Today, PAHO's director, Dr. Carissa Etienne, will be reporting on the evolution of the pandemic in the region, the situation of vaccination against COVID-19, and also the opportunity with the vaccination week that we are celebrating this week. Today with Dr. Carissa Etienne, we have Dr. Jarbas Barbosa, Assistant Director here at PAHO, and also Sylvain Aldiguere, Incident Manager. So now I would like to ask Dr. Carissa Etienne to share her remarks with us. Dr. Etienne.
Thank you, Sebastian. And a very good morning to all of you. Thanks for joining today's press briefing. Over the past week, more than 1.4 million people became infected with COVID-19 in our region, and more than 36,000 lives were lost from COVID-related complications. In fact, 1 in 4 COVID deaths reported worldwide last week took place right here in the Americas. Many health systems, especially those in South and Central America, are still struggling to cope with the influx of patients. Since the beginning of 2021, several countries in our region are reporting an increase in cases in the younger population, linked to increased exposure and no vaccination in these groups. This has led to an increase in hospitalizations. The hospital stay of these age groups is usually greater compared to those over the age of 60. So PAHO is orienting our countries to plan on coping with sudden increases in the consumption of critical inputs such as oxygen, intubation drugs, personal protective equipment, and infusion pumps. Canada's infection rates have surpassed the US figures for the first time in the pandemic. Cases are also surging across the Caribbean, as Guadeloupe, Martinique, and the Bahamas are reporting new spikes. Anguilla reported more than 60% of its total cases in the last 7 days, and weekly cases doubled in Puerto Rico during the same period. Nearly every country in Central America is reporting a rise in infections. Hospitalizations are at an all-time high in Costa Rica, and we expect more patients will require care as the country reported a 50% jump in cases in the last week. Guatemala's hospitals have also reached maximum capacity. Infections are spiking across South America. Infections in Colombia will soon reach January levels, and ICU beds are running out in major metropolitan cities like Bogota and Medellin. Peru, Bolivia, Argentina, and Uruguay are also reporting a rise in infections. It is no surprise then that many countries in our region have tightened public health measures by extending curfews, limiting reopenings, and imposing new stay-at-home orders. Of course, these decisions are never easy, but based on how infections are surging, this is exactly what needs to happen. We know that these measures work, and I commend leaders across our region for putting health first. As of this week, more than 317 million COVID vaccine doses have been administered across 49 countries and territories in our region. Of these, nearly 7 million have been purchased via COVAX, and another 470,000 are en route to some of our countries. In the next few weeks, countries should receive their second COVAX shipments. And while doses remain limited, most countries should see a considerable increase in doses from the first wave. Based on the allocation criteria established by the COVAX facility, 9 countries in our region are starting the second deployment, to be followed by others in the same sequence as for the first deployment. Nearly 7 million COVID vaccines will be arriving in these countries between May and June. The first COVAX shipments were an important opportunity to troubleshoot issues before deliveries accelerate. As we ready ourselves for the second COVAX deliveries, it's worth raising 3 encouraging lessons that we have learned. First, prioritize health services and save lives. While vaccination plans differ by country, most have done a great job following WHO and PAHO recommendations at prioritizing early doses for health workers and others on the front lines and saving thousands of lives, protecting the elderly and persons with underlying conditions. Second, public health measures. Because supplies remain limited, vaccinations alone will not end the pandemic, and they need to be complemented with proven public health measures to reduce deaths and protect health systems. We need to continue to wash our hands, wear our masks, and maintain social distancing. And third, that investments pay off. In anticipation of the arrival of COVID vaccines, many countries in our region invested in their cold chain equipment and capacity. Today, we are seeing these improvements pay off as deliveries have been quickly put to use, even for vaccines requiring ultra-low refrigeration. As deliveries pick up pace, our cold chains and supply chains will be tested further, but they are ready for that challenge. Experience shows that countries across the Americas have adapted COVID immunization campaigns to prioritize safety by designating COVID vaccination sites away from clinics and hospitals, organizing drive-through sites, and hosting door-to-door campaigns to reduce the chance of transmission. Thanks to these efforts, our region has administered nearly every COVAX dose that it has received thus far. Our region has demonstrated that it can successfully distribute COVID vaccines quickly and effectively. Yet, supplies are still far behind what is this region's urgent need for more doses. And that's why we want again to urge countries with extra doses to consider donating a significant portion of these to the Americas, where these life-saving doses are desperately needed and will be promptly used. Vaccines are especially important for vulnerable populations, like our migrants and the millions living along our borders, where we have seen outbreaks surge and ripple across our region. Expanded vaccination will also ensure that our people and economies can begin to reopen, rebuild, and recover, With the increasing incidence of COVID-19 variants of concern, timing is critical. But while our eyes are set on COVID vaccination, we are observing Vaccination Week in the Americas. So we must not forget the importance of maintaining our routine immunizations. Last year, nearly 500,000 fewer children in the Americas were vaccinated for diseases like diphtheria, tetanus, and pertussis or whooping cough. And more than 300,000 children missed their measles vaccinations. These trends are not new because for some years we have seen immunization coverage decline in our region. Lockdown measures have been challenging, and some parents remain fearful of taking their children to a doctor. However, our health systems are well prepared to deliver routine immunizations safely, and in most places, childhood vaccines are being administered separately from COVID-related care. So children must not skip their shots. Parents, please be aware. I would like to wrap up today's briefing by celebrating the work of our health workers, who throughout the course of this week will vaccinate almost 100 million people against preventable diseases like measles, influenza, and human papillomavirus, and will at the same time administer nearly 9 million doses of COVID vaccines across 31 countries and territories in the Americas. Our health workers have made extraordinary personal sacrifices and persevered even under the most challenging circumstances. We owe it to them to do everything that we can to keep ourselves and our communities safe, including by getting vaccinated when it is your turn.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Now we are going to move on to answering the questions that we have received. Please, when you send your question through the Q&A button, do include your name and media outlet. We do have several questions on variants and the C37 variant. This is Vilches and also Mr. Garcia from the newspaper in Peru. We have another question from Nicaragua and also questions from Reuters. And the question is, in Peru, C37 variant is being evaluated as a new threat during the pandemic and maybe the reason for the rise in cases in the country and in Chile. And they're asking what is the information that PAHO has in connection with the spike in the number of cases in Peru and Chile. And Gabriel is asking what is PAHO's recommendation given new variants in the region, and whether Nicaragua could be prepared to also report cases of the new variants. Dr. Aldiguieri. Thank you, Sebastian. Thank you for those questions from two different sources. I will try to put together my answers and address both questions. The emergence of new variants for SARS-CoV-2 is a biological natural event which is expected. Those variants may be introduced or emerge in any of our countries. As a matter of fact, in connection with the C37 variant, that variant is derived from another one that has already been circulating worldwide. That is the B11. And that variant was already circulating starting in December in Peru, and in subsequent months, it was also detected in Chile, and there was at least a case in Argentina, Brazil, and Ecuador. However, it is not accurate to raised concerns since the origin is not clear. It has already been detected in the UK, Brazil, the US, Australia. That variant has some common characteristics with some other variants of interest, but there is no evidence to support a higher transmission rate and or a higher lethality, even though it has been widely distributed in some areas of Peru. That variant is co-circulating with other variants that are already present in the region. And at this moment, that variant is not dominant, and it is early to associate it to the new epidemic waves. And now, more as a general comment, and this is something that applies to all of the countries in the region, it is important to maintain the surveillance of the variants articulated with epidemiological surveillance to detect changes in the transmission patterns in a timely fashion, changes in the clinical aspects of the disease, higher lethality or transmission, or a failure in the application of the vaccines that we currently have available. A precise response to Nicaragua is that Nicaragua will be receiving material to molecularly screen variants of concern. The network of surveillance that PAHO has in the countries is working to timely detect that variant, and that also includes the National Center of Diagnosis and Reference with the Ministry of Health in Nicaragua. And I hope I have addressed the questions by the journalists. Thank you. Thank you, doctor. The next question by Mariana Souquet with Efecto Cocuyo from Venezuela. We already know that some adverse events have already been reported, for example, with Johnson & Johnson and AstraZeneca vaccines, but she's asking whether we know about other adverse events derived from other vaccines that are not approved by WHO and that are being administered in the Americas, and whether there are no effects or whether they are not being reported. And she would like to know what information is available in the Americas. Dr. Barbosa, thank you for the question. Surveillance, or post-marketing surveillance, as we call it, is an important factor behind vaccine safety, because vaccines have been assessed as part of preclinical trials to determine adverse events, but once the vaccines are used in the general population, we have information from the real world with dozens of millions of doses that have been already administered. So it is important to have a good surveillance mechanism to identify adverse events, and most importantly, adverse events that were not identified in clinical trials. That is not only for COVID-19 vaccines. This is part of the safety behind all of the vaccines and medicines that are used worldwide. There is a global surveillance system through which all of the countries report adverse events with vaccines and medicines. From PAHO, we are also working a great deal with the countries to strengthen their surveillance system, the one that they have after the marketing of the vaccines, because this is important to guarantee the safety of the vaccines. So far, we have no information from the countries in the region in connection with adverse events that were not expected based on the clinical trials. That is reported on a routine basis for PAHO and also WHO. This is a system that oftentimes includes real-time information, and whenever we find an unexpected adverse event, an assessment, an independent assessment with experts is used to establish whether there is a causality link between the event and the vaccine, because oftentimes when a vaccine such as this one is used in the elderly, there could be deaths or problems due to other diseases that have no relationship to COVID-19 or the vaccine. That's the reason why all of the reports need to be assessed by that commission. So far, we have reports on adverse events with the severity, and in the numbers that we had expected, they are quite slight, quite moderate. For example, pain in the site of administration, and for example, cold chills after the vaccine on the following day, but all of this disappears without any further need for care. Thank you very much. The next questions are by Luke Taylor from Scientific American, and also Tobias Kaufer from TWEL in Germany. And the questions are
there any lessons to be learned from the recent surge in cases in Chile despite its rapid vaccination rollout? How can we explain the recent record numbers of infections? Y Tobias, en el mismo sentido, también pregunta, why are infections increasing in Uruguay and Chile, even though there is a high level of vaccination? Dr. Aldiguieri?
Yes, thank you, Sebastian, and thank you to both journalists for this series of questions. Chile and Uruguay have both excellent surveillance systems, and both have been very proactive in rolling out the vaccination response. Both countries have experienced an increase of their trends during the first quarter of 2021, including with an important impact on their health services. The comparison stops here as we have commented many times, the continent, and sometimes the countries, is a mosaic of different patterns of transmission, and countries have different approaches for implementing the recommended public health and social measures. In Chile, we are starting to see what may be a plateau in reports of new cases using the data provided by the Ministry of Health. In terms of vaccination, Chile has administered 71 doses per 100 people during the first 4 months of 2021, and Uruguay has administered 44 doses of vaccine per 100 people. These figures are averages for the whole population, and there are differences among age groups. It is also important to note that both countries are using different vaccines that all require 2 doses. They are also administered gradually to different target groups within the population. What is important to take into account is that the first objective of the vaccination response is to save lives, as it targets first priority groups that are more likely to develop a severe COVID-19 disease. Therefore, initial vaccination has targeted older population groups in these countries, as well as people with underlying conditions. And in this context, we expect to see first a decrease in severity, such as hospitalizations in ICU, for which we have a first indication in the elderly population in Chile. The effect on vaccination on overall transmission is probably at the moment still limited and should be seen only when the coverage among younger adults increases. It will take, as a conclusion, it will take more time for the countries to see an impact of the vaccination campaign on the dynamics of the COVID-19 pandemic. Even then, other factors, such the adjustment of the public health and social measures, as well as the potential role of the variants of concerns may counterbalance negatively the effect of vaccination. I hope I have answered the concerns of both journalists on this topic. Thank you.
Gracias, doctor.
Thank you, doctor. The next question is from Blanca Valadez from the Millennium Group in Mexico, and her question is, Marcelo Pedral, Foreign Secretary of Mexico, criticized COVAX and also asked Spain, Portugal, and members of the Ibero-American community to create a common front for the production of vaccines. He's asking, what is PAHO's opinion in this regard and whether the COVAX facility has not properly worked and therefore a new plan is required. And he would also like to know whether the countries may request the reimbursement of the payment made to acquire vaccines through COVAX. Dr. Barbosa. Thank you. Thank you for this question. I think that Mexico's ambassador has underlined very important topics that we have already discussed during the press briefings. The first is that without a global agreement, a new agreement of the countries to guarantee equitable distributions of the vaccines produced will also still have this situation in which there are countries, developed countries that have a lot of vaccines and middle income and low income countries without access to the vaccines they need. Because why? Because according to market rules, some producers are providing 100% of their production only to developed countries that have already acquired the vaccines before. The COVAX facility at this point, for example, has AstraZeneca's production, and AstraZeneca being produced in 2 sites. One of them is India, and this is well known to everyone because it has been published in all of the media outlets. India is having some problems to authorize the exports of the vaccines. So all of the AstraZeneca vaccines produced in the Serum Institute of India were not authorized by the government to be exported. The COVAX facility and WHO are negotiating with the government of India to reach an agreement so that at least they can share the delivery by the Serum Institute of India, so that part of it is used for immunization in India and another part is used for the COVAX facility. But the other producers that are already committed with COVAX, such as Janssen, will be providing in July. Pfizer will start in June, but with a very limited amount. So unless there is a change in the rules, this is going to be the reality of the next 2 months. So that's the reason why I think countries in a very proper way are underlying the need to establish a new framework, a new global framework for a proper response to the pandemic, because with the rules we currently have, inequality in access is a reality, is a challenge, and without a change to these rules, it will be very difficult to overcome. PAHO, in addition to facilitating the countries' access, that is to say, those countries that are participating in COVAX, we're also working with our own director. We have already started the second round of distribution through the COVAX facility to all of the countries that are participating and that are ready to receive the vaccine. We're also negotiating with the countries so that they can donate vaccines. And even some countries have already announced those donations so that more significant access to vaccines can be granted in the region of the Americas. The negotiation of the countries in the Americas with COVAX depend on the countries. Some countries have a modality of participation that entails that they may recover their investment if they leave the facility. But the goal here is different. The goal is to enhance access and to guarantee that the facility, the COVAX facility, may receive the vaccines from those producers that have already committed to sending the vaccines, and in April or May have new producers also contributing the vaccines instead of waiting for the next quarter. So the idea would be to have a goal, the goal of enhancing access, the necessary access to vaccines in Latin America and the Caribbean. Thank you very much.
Thank you, Doctor. We have several questions related to the situation in India and in English.
Been impacted by the rise in cases in India. How does what is happening in India now relate to the trends of the pandemic in Latin America? Dr. Etienne?
Let me thank you for this question. The region of the Americas stand in solidarity with the people of India. As we have said over and over again, healthcare is a right, and no one should have to struggle to access life-saving treatments regardless of where they live. Our region is still under the grip of this pandemic, and many cities in our region had to deal with shortage of supplies, lack of availability of ICU beds, and limited medical staff, and staff that are overstretched for months. In several countries of South America, the pandemic in the first 4 months of this year was worse than what we faced in 2020. So this shows that we will only overcome this pandemic with a combination of rapid and equitable vaccine access and effective preventive measures. This pandemic is not only over, it's only not over, it is accelerating. And while we don't have vaccines for all that we need to keep our focus, we must continue to work on the preventive measures. When cases rise, we therefore must tighten social distancing recommendations. We need to reinforce the use of masks. I know that I sound like a stuck record, but there is no other way. But it is also important that countries in our region are prepared to deal with a rapid rise in cases, with the personnel, supplies, and the hospital beds that may be needed. Preparation to treat those infected with COVID-19 prevented many deaths last year, and we must keep it up to save the lives of those that are being exposed now to this virus. And we are really in empathy and sympathy with our colleagues in India.
Thank you, Dr. Etienne. Siguiente pregunta es de Katia.
Thank you, Dr. Etienne, from Katia Rojas Toro, from Destino Panama. And the question is the serious health crisis of India. How will it affect the distribution of vaccines through COVAX, and in particular for AMC countries of the region, those who receive vaccines free of charge? So how are they going to be able to receive vaccines? Or what is the impact of suspending supplies of AstraZeneca vaccines in India? Dr. Barbosa, thank you very much. It is a very serious impact indeed, because we have 3 countries in the region who are receiving AstraZeneca vaccines from India: Bolivia, Haiti, and Nicaragua. But with the interruption from India, which so far has not received a decision or hasn't made a decision to continue to send vaccines, all the other countries will be perhaps subject to significant reductions, because AstraZeneca vaccines from other manufacturers are going to be shared among all. PAHO has been working with manufacturers with the COVAX mechanism to guarantee deliveries for April and May. with some delays, but we have already started the second set of deliveries, and up to the month of June, we have to always confirm the amounts um, and all the other relevant information. But we have a serious problem because not only these three countries can be affected, but also the rest of the countries in the world, which are going to have fewer vaccines during April and probably the month of May. The level of negotiations is very high with the Indian government so that an agreement may be reached, but we should also underscore the needs of other countries, developed countries that already have a large amount of vaccines that have already been administered to the populations, and these countries may make donations and make agreements with the manufacturers so that those manufacturers such as Pfizer, Janssen, and others that are part of COVAX are able to immediately start delivering vaccines through the mechanism, through the facility. And this is the most immediate way in which we can achieve more equitable access, and so that inequity in access will not increase in the coming months and weeks. We are all concerned, very concerned about this situation, and we are on a permanent basis negotiating through COVAX with the Indian government to come to an agreement so that India can fulfill the contracts they have signed through COVAX. Thank you. Thank you. Yes, the next question is from Jacqueline Vicheda from El Mundo in El Salvador. Last week, PAHO talked about an increase in infections in Central America. Does this include El Salvador? And if so, why is the reason, or what is the reason why there has been an increase in infections, Dr. Aldigueri? Thank you, Sebastián, and thank you, Mr. Viñeda. I'm going to frame my reply within the context of Central America. During the pandemic, we have a mosaic of different forms of transmission in the different countries in the same sub-region, including between countries that share a border. And I repeat, this is Central America. The difference between epidemiological patterns in the case of SARS-CoV-2 depends on the strict implementation or the more or less implementation of public health measures, as well as differences between surveillance systems. These are not standardized systems among the countries. On the contrary, these are systems that are harmonized with common axes, but with some um, differences in the way and the rate at which information is shared. What we have been seeing for a few weeks in Central America is an increase in transmission in countries such as Costa Rica and Guatemala. And this is confirmed too by the data of occupation of ICU beds in hospitals. In the case of El Salvador, we are more in a plateau situation in regards of report of new cases and report of number of deaths. And we have reports from the health ministry dated April 24th uh, saying that the occupation of ICU beds is coming down. In every case, this applies to Central America and also to other subregions of the continent. We encourage countries to report on a daily basis their number of new cases through the channels of the international system, and to do antigen tests to do a follow-up of trends to the first level of care. In El Salvador, since the last quarter of 2020, the antigen detection tests have been included in their lab network, it is also important to remind and repeat and emphasize that an epidemiological situation with a transmission pattern that seems to be under control in terms of trends can become complicated in just a matter of 2 weeks if the public health measures are not calibrated and adapted to the figures and numbers that the system of epidemiological surveillance is managing. I hope I have answered your question. Thank you. Thank you, doctor. The next question is from Kadim Joseph from the Observer Media in Antigua and Barbuda. And the question is in English.
Showing up to be vaccinated per day in Antigua and Barbuda has slowed in recent weeks. While there hasn't been any rationale given officially, are there any best practices in keeping interest in COVID vaccinations high amid skepticism? Dr. Etienne?
So thank you for this question. Without a doubt, over a few years, we have seen the growth in vaccine hesitancy. So let me say that the vaccines that have received emergency use listing by WHO have proven to be effective in preventing moderate and severe illness from COVID-19. Vaccines are safe, those vaccines are safe and they are effective. What is more is that vaccines will ultimately be the way out of this pandemic. And we rely on all persons cooperating to ensure that we can reach this goal. As you heard Dr. Barbosa earlier, this region has for decades, we have had strong surveillance mechanisms and well-defined procedures for post-vaccination side events. So the surveillance system has been in place and it has worked. What we have done is we have beefed it up in regards to COVID vaccines. As you've heard Dr. Barbosa say as well, we have not had any reports of severe side events from vaccines in this region. But I assure you, if we did, we would be on top of it. I think if we want a good example, let us look at what has happened in Israel. Israel recently reported that they had arrived at herd immunity. And on that basis, because of the coverage of COVID-19 vaccines, as a consequence, they've opened up all the schools, they've reopened the economy, they've reduced their mask wearing by the population, they are dealing with increase and lowering the social distancing. So it works, but it relies on each of us making that commitment to get vaccinated. Let's be clear that the risks from a COVID illness is far higher, much, much higher than the risk of side events from vaccine. So please, I am appealing to all, let's take the vaccines. It is each of our responsibility for ourselves, for our families, but for our country. Our countries cannot restart their economy successfully until we stop this pandemic. So do your part. Thank you.
Gracias, doctora Etienne. Siguiente pregunta es de Adriana Brasileiro del Miami Herald y me gustaría darle
Next question from Adriana Brasileiro from the Miami Herald. Adriana, please, you have the floor to ask your question live.
I have a question about Cuba. It's a country that's betting on producing its own vaccine to inoculate its population. What can PAHO tell us about the latest developments in Cuba's COVID vaccine trials? Is the Soberana 2 close to production? And the other question I have is, How confident are you that Cuba's biotech industry will be able to produce a COVID vaccine and begin vaccination by this summer, as some in the Cuban government have indicated as a goal? Thank you.
Gracias, Adriana. Doctor Barbosa, ¿podría contestar?
Dr. Barbosa, could you please answer this question?
Let me tell you what the situation now. First, I think that's important that every vaccine development project in Latin America and the Caribbean is very welcome. I think that it's very important to recognize efforts from many governments, academic institutions in our region that are trying to develop vaccines. It's important because maybe we will need the vaccines against the coronavirus for many years ahead. In the case that we need to have boosters or to vaccine against variants. So it's important to have more capacity in the region to produce vaccine. Second, the information that we have is that the Soberana 2 vaccine is still in the phase 3 clinical trial. This is important. All vaccines and medicines, before being released to be used in the population, they need to complete the phase 3 clinical trial, they need to provide the information, and they need to be licensed by a national health regulatory authority. This is a sovereign decision of each country. The countries don't need to be supported by WTO or PAHO to do that. They make their own decision based on the dossiers that are provided by each producer to release the vaccine to be used in the country. A vaccine to be purchased through the PAHO's revolving fund needs to be pre-qualified or to receive the emergency use listing authorization by WTO. So far, we have only this authorization for Pfizer vaccine, for AstraZeneca, produced in 3 different sites, and we are expecting, and Janssen vaccine, and we are expecting to have the assessment completed for other vaccines in 2 or 3 weeks. But this Soberana vaccine is part of the 91 projects that are in clinical trials in many different countries and regions. So this is good news, but all the vaccines in the region or in other regions needed to accomplish with the same criteria. To be used through the revolving fund, they need to receive the pre-qualification or EUL from WTO. To be used in a country, it's a decision for the country that reviews the dossier and probably will provide the information about the quality, the safety, and the efficacy related to that specific vaccine. Thank you.
Gracias, doctor.
Thank you, doctor. Next question is from Douglas McIntosh from Jamaica Information Service in English.
An update on the number of COVID-19 manufacturers currently engaged in clinical trials and how far along are they with their engagements? And also, how many additional manufacturers have indicated an interest in joining the COVAX facility to enable the provision of vaccines? Dr. Barbosa?
Thank you, Douglas, for this question. The first one I have just answered. We have now 91 projects for vaccine development projects that are in the clinical trials phase, in different stages. Some are in the clinical trial phase 1/2, others in 2, others in 3. And we know that because there is a public platform that is coordinated by WTO that every clinical trial that wants to upload their information and we can check, and WHO also update the vaccine developed scenario every week. So as today, the information is that we have 91 projects that are in different levels of clinical trials. Again, this is good news, but hopefully all of them will finalize the clinical trials and we will have good results for safety and efficacy. About how many manufacturers have indicated interest in joining COVAX facility, we have many producers, because one pillar of the ACT for vaccines is also to support development. So 16 vaccine development projects receive the funds from this pillar, and they are committed to produce vaccines to be used through COVAX. Sorry. So we have at least these 16. Now, what's the situation now? We have AstraZeneca in different sites, in China, in Spain, in Italy. They are committed. They have signed contracts with COVAX. We have Serum Institute of India producing the AstraZeneca vaccine there. We have Pfizer, we have Janssen, and we are in negotiations with other producers too. But remember that they need to receive the pre-qualification or the EUL before being purchased through the revolving fund on behalf of the COVAX facility to countries in Latin America or the Caribbean. The main problem now, Douglas, to be very candid, is not the number of producers. Is that even the producers that are already committed to COVAX, they probably will start with the regular schedule that they have provided. They will start deploying their vaccines to COVAX by the end of June and July. So I think that the main problem that you have now is the limited access for the producers that are already committed to COVAX. So it's important to increase the number of producers. For this reason, the pre-qualification team of WHO is reviewing the dossiers for Moderna, Sinopharm, and Sinovac, and other vaccines that are in coordinating with WHO. But we needed to respond now to this very limited access with the current producers that have already committed the vaccines to COVAX in order to guarantee that they can accomplish with these contracts, they can provide the vaccines, and they can anticipate the vaccines in order to get a more wider access to the vaccines for Latin America and the Caribbean. Thank you.
Gracias, doctor. Y solo para compartir que en el chat le estamos...
Thank you. We are also sharing on the chat a link where you can read about the status of the process of different vaccines in WHO. From Reforma newspaper in Mexico. First question, why are younger people longer in hospitals more than older people? For Dr. Aldeguerri. Thank you, Sebastian, and thank you to the journalist for her question. Given that they are younger, these youths are more resilient to complications that are developed in the context of ICU's complications such as pneumonia, sepsis, cardiac problems, renal problems, etc. Young people suffer from fewer chronic diseases that complicate severe forms of COVID-19 that requires ICU hospitalization. But once a person goes to an ICU, then younger people are going to have fewer complications related to very specialized care, or maybe they will have complications at a later moment in the development of their disease. However, this in the region, we see a large proportion of younger people who are coming down with complications. And this tells us that it is important for everyone to follow basic care measures, including access to health care services, and to consult with your doctor as soon as possible, as you, the moment you suspect that you may have COVID. I hope I have answered your question. Thank you. Thank you, doctor. The next question is by Francisco Moreres from Cover News in Argentina. And it says, do you recommend to vaccinate with one single dose instead of two doses in countries that have not enough vaccine for the whole population? In other words, vaccinating more people with one single dose than fewer people with two doses. What do you think about this, Dr. Barbosa? Thank you for your question. In addition to delivering vaccines, PAHO has also provided technical cooperation to countries with recommendations about how to use these vaccines. The recommendations are aligned with the recommendations made by the expert strategic group, SAGE, as it's known in English. And these recommendations from SAGE, the strategic group, the information and the data are accumulated, and the more we have information from the real life, then but SAGE says that there's no evidence to support that only one dose should be given. The only vaccine that provided information to the prequel and for the SAGE group, and this was the Janssen vaccine, which is a vaccine division of Johnson & Johnson. This Janssen vaccine provided information of safety and efficacy with one single dose. All the other vaccines submitted data for two doses. We know that there are some studies out there with vaccines that are being used with two doses that are testing for use with one single dose alone. But these are not studies that have been completed, and the data are not ready to be published. So the recommendation at this point in time is to continue to use two doses for those vaccines that require two doses, and the interval, the maximum interval should be used. For example, for the AstraZeneca vaccine, SAGE has recommended, and we share this with all the countries in the region, that they should use the maximum limit of 12 weeks for the second dose. And this will allow for more people to be vaccinated if you use this much longer interval. So the vaccines that have been approved for two doses should continue to be used as a two-dose vaccine up until we have the information to support the fact that they can be effective with one single dose. Thank you. Thank you, doctor. We are coming to the end of our press briefing for today. And the question is from Maria Camila Castro, who is a journalist from Blue Radio in Colombia. And there's a similar question from Ms. Salomon from Associated Press. So Maria Camila says,
beneficiaries of the vaccine donations by the Spanish government after Pedro Sanchez announced that they will donate between 5 and 10% of COVID-19 vaccines the country will receive in 2021 to Latin America. Y similar, vinculado con Estados Unidos, Gisela Salomón de AP.
And Gisela Salomon from AP says,
solidarity from international organizations, developed countries such as France and the US have donated or promised to donate vaccines. Do you have information on whether any Latin American country will receive doses donated by any developed country? Dr. Etienne?
Let me thank the journalist for this question. Let me state first that we enthusiastically welcome this type of commitment from countries that have secured more doses than they can use. And PAHO has been negotiating with many of the developed countries for just that, the sharing of doses. The announcement from Spain is a show of solidarity and a contribution to the well-being of our region. We also congratulate the United States government on their announcement earlier this week that they will share up to 60 million doses of the AstraZeneca vaccine. We see these commitments as very important steps in the right direction, and a trend we hope will be followed by other countries that are able to donate. In fact, we urge other countries to make similar commitments. No vaccines should be sitting in warehouses where they can be promptly used to, when they can be promptly used to save lives. And PAHO is ready and able to quickly deploy vaccines to the countries in our region that have been and are being heavily impacted by the pandemic and are now struggling to access more doses. As I said earlier, our member states have demonstrated the capacity to effectively deliver these vaccines to help protect their health workers and vulnerable populations. Let me go back to the original question from Colombia. PAHO has been in active discussions with the Spanish government and other governments to request donations of doses that exceed the needs of this country's population. And we have stressed the acute needs of our region. In its commitment, Spain indicated that this donation will be channeled through the COVAX mechanism and prioritizing Latin America and the Caribbean. PAHO, through the revolving fund, will likely oversee the distribution to our countries. But as now, no specific recipient countries have been identified. We continue to be in touch with Spain about the timelines and the quantities that will be donated. And once that picture is clearer, PAHO will propose a strategy that is focused on equity with special consideration to those countries that have had limited access to vaccines up to this point. So stay tuned and thank you for joining us again for this week's press briefing.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado
Thank you, Dr. Etienne. This is the end of today's session. Let me remind you that you can find more information on PAHO's website, www.paho.org/coronavirus, and you can also be in contact with us through email. Again, thank you for joining us, and we'll see you next week. Let's be careful out there and have a good day.